Hello, I'm Esther Githu. Welcome to Africa 54. Here's what's coming up. Heavy rains and devastating flooding kills scores of people across Kenya while forcing many others to flee their homes. Zambian officials say the country's commitment to strengthening the rule of law and justice in the fight against corruption is paying off. And it's Africa Vaccination Week. We'll look at the progress made and the remaining challenges. All this and much more coming up on today's Africa 54. We begin in Kenya, where the government says flash flooding and a major landslide in central Kenya has killed at least 45 people and injured over 110 others as flood water swept away houses and cars in the town of Mai Mahiu. Police initially blamed the flooding on a burst dam, but the Ministry of Water later says it was caused by a river tunnel under a railway embankment becoming blocked with debris. Hours after the rain subsided and flood waters began to recede, local residents pulled motorcycles and household belongings from the mud while searching for missing loved ones. Other survivors recovering from their wounds at a local hospital spoke of water sweeping their families into the night without hope of seeing them alive again.
When I opened the dining room door, the water gushed in and made its way through the kitchen. That's how I got out of the house. My husband was forced back into the house by the water, and by that time the house had already started coming down. He managed to quickly maneuver and get out. My daughters who were in the next room were swept out of the house by the force of the water.
My last-born daughter, who was holding on to my back while we were in the water, was begging me not to leave her. I reassured her and asked her to hold on to the nearby floating debris. Unfortunately, she is gone now. My eldest daughter is in hospital at Mai Mahiu, but the rest...
Houses in flood-prone areas have been submerged, causing people to seek refuge in schools. Kenyan President William Ruto has taken swift action in the crisis, leading an emergency cabinet meeting to strategize the government's response. VOA's Paul Ndiho spoke to Jack Oduor, a community organizer in Mathare, an informal settlement in Nairobi, who shared the devastating impact of the floods on his community.
We are in Mathare. This is a river that caused a lot of havoc. And we are trying to do a rescue mission for us to be able to get people off this location. So currently we have cases of 15 deaths that were caused. This river busted, and all these you see, all these locations used to have people's houses. They have all gone. And you see the other side, those are the still water flooding. So things are not right. And the other side, I'll show you where we have a lot of houses that have been swept away. I have with me about 5,000 households people that how their houses were swept away, and it's not a good scene. As Transformers organization, we're trying to get the correct data so they can have a humanitarian support to give them I can call it a decent living and an harmonious location for them to get their life started.
Are you a community leader in that area? What are you and your people trying to do to help these people who are in need?
Well, I told you earlier, we've lost 15 people that are confirmed, and that is sad. We are, losing a life because of the flood at the middle of the night is really strong. So as Transformers organization, we've set up our call center. We are receiving donations for what we've done so far. We're receiving donations, but we're not giving all the donations. We only gave grains, the food stuff, but for the few, we only provided 50 blankets. But through friends, we've gotten over 200 blankets now. But what we talk about, we need now to have a clear identity, data verification. We go to the house to house. So from yesterday, we've been taking data, critical data that we have it in our space, and not only sending this data, we go, I've been to this house, every doorstep, getting their data and sending even to the friends that were able to support. Some have come that they would like to support, and we are even calling for the medical teams to come and, maybe you can only provide the food, but people who are doctors, nurses can come and provide. The children are here suffering, food. That's what we are trying to do, just bring everybody on board. And
earlier today, President Ruto convened a cabinet meeting following the floods. They are trying to figure out how to respond to some areas that have been hit so hard, affected, like your place that you're speaking from. Isn't that a way of showing that they care? The government is trying to help the people in need.
Well, I would tell you, it's easy saying than done. You know, the government talks. I'm not a guy of talks. I need action to be taken place. I need to see that what they said is being implemented. They're not implementing anything. It's almost a week now, because this thing happened on Wednesday, and now we are on Tuesday, and almost a week. What have they done? There's not even, these people do not even have insurance covers. So how will they say that they want to be active when after the occurrence of an event? This should be planned, that they know we have this kind of number of slums, and what is the projection? Yes, we need to get them out of that space. They have not even come. Even now, are you seeing any government vehicle here, or any person from the Ministry of local government? They're not here. We are all here trying to get all these things. So it's a lot of talk, and it's high time we get out of the talks and we start actual implementation of what the treaties that we make.
That was Jaco Duor, a community organizer in Mathare, an informal settlement in Nairobi. Zambia's corruption perception index is improving for the first time in a decade, according to Transparency International Zambia. The country's authorities say their commitment to strengthening the rule of law and justice in the fight against corruption is paying off. Kathy Short reports from Lusaka.
Transparency International Zambia Chapter Executive Director Maurice Nyambe told VOA in Lusaka that the Corruption Perception Index is a critical research conducted at a global scale. It is currently the most widely used measure of public sector corruption across the world.
Zambia has actually improved by 4 points in terms of the score. Now, the CPI score runs on a continuum from 0 to 100. And basically the simple explanation is that 0 means you are very bad in terms of corruption, the worst of the worst, and then 100 means you are very clean as a country in terms of corruption. So over the last 10 years, Zambia has been, first of all, declining, and then specifically for the last 3 years, we have had a constant score of 33 out of 100. And so now we have improved to 37.
According to Transparency International, the Corruption Perception Index, or CPI, is used to rank countries by their perceived levels of public sector corruption as determined by expert assessments and opinion surveys. The CPI defines corruption as an abuse of entrusted power for private gain. A 2023 IMF diagnostic report on Zambian governance and corruption indicates that corruption is believed to have inflated the costs of numerous high-profile tenders and construction projects during President Edgar Chagwa Lungu's tenure between 2015 and 2021. It further states that huge financial resources invested in infrastructure projects, such as road construction, have been identified as providing avenues for corruption. Besides impacting the economy, the Zambia National Women's Lobby, an NGO championing gender equality, states that female leaders in Zambia have encountered significant barriers to political participation due to corruption. Executive Director Juliet Chubota says the new Corruption Perception Index is now responding to concerns by female leaders.
It's now responding to what we have been advocating for. We have been advocating for corruption to reduce so that women operate freely in an environment which is corruption-free. Because corruption reduces the number of women to participate in leadership and governance processes.
Felix Nkulukusa, Zambia's Secretary to the Treasury, reiterated his government's commitment towards the fight against corruption at a recent meeting in Washington.
We have established the interagency collaboration for asset recovery, where in addition to the Anti-Corruption Commission, we have identified about 21 institutions, some of them in the law enforcement, others in other areas that are collaborating together to try and recover all the assets that have been gotten through corruption.
Critics of President Hakainde Hichilema have charged that arrests on corruption allegations have only been targeting political opponents, describing it as a witch hunt of the previous regime. The Zambian president insists that the fight against corruption is not meant to victimize his political opponents. In 2022, Zambian authorities set up the Economic and Financial Crimes Court to fast-track corruption cases. No convictions have been secured thus far. Kathy Short, VOA News, Lusaka, Zambia.
Economic and accountability bodies in Malawi are urging the government to address flaws in the public procurement system. A 2021 Malawi Assurance Report on public infrastructure projects suggests pervasive corruption in Malawi's public sector. The construction industry is particularly affected. We'll have more from Lilongwe on Wednesday. U.S. presidential candidate Donald Trump is planning to campaign in the Midwest state of Michigan this week. It's one of a handful of states that could swing the results of November's presidential election. VOA's correspondent Scott Stearns reports.
Voters in Michigan chose Donald Trump in 2016, but Joe Biden in 2020. It's a state both campaigns believe they can win this November. Part of Trump's approach in Michigan is winning over auto workers whose jobs he says are threatened by Biden renewable energy plans, including subsidies for electric vehicles. It's a message he's bringing to a rally in central Michigan Wednesday.
We'll be in Michigan, a state that he's destroyed because of the auto industry. We're not going to have any jobs left in Michigan, no auto jobs left in Michigan. They're all going over to China and other places with this ridiculous EV mandate, electric vehicle mandate.
The main union representing auto workers in Michigan endorsed Biden over Trump. Paul Torrente is a union representative.
Donald Trump most likely has the support of big corporations in Michigan because they are the ones that actually hold the working class down. So for him to actually say that he has Michigan, he doesn't have the working people in Michigan. He has the 1%.
That's a message Biden is using to keep union household voters, who an NBC News poll says still favor him over Trump, but by a smaller margin than 4 years ago.
Donald Trump's vision of America is one of revenge and retribution. A defeated former president who sees the world from Mar-a-Lago and bows down to billionaires, who looks down on American union workers. It's not just he's not supporting, he looks down on us.
A potential liability for Biden in Michigan are traditionally Democratic voters who oppose his support for Israel in the war in Gaza. Omar Suleiman is an imam at the Islamic Center of Detroit.
He is intentionally, I think, pursuing a policy that is not only inhumane and disgusting to everyone that hoped for something different, but will be consequential in November 2024.
In Michigan's Adams Township, voters believe Biden has mishandled immigration and lost control of the border, says Township Supervisor Randy Johnson.
Look how many, and I'm not saying this in a bad way, but look how many people came in. Look how many people we didn't know came in. Look how many bad people came in. Trump's wall would have isolated all that.
Trump says Michiganders are tired of Biden.
This November, the great state of Michigan is going to tell crooked Joe Biden, "You're fired, get the hell out of here."
Biden says it's the strength of labor unions that will help him win re-election.
You're the best in the world. You know, you had my back in 2020, and because of you, I'm standing here as President of the United States of America. Because of you. And that's a fact. Because of you, in 2024, we're going to make Donald Trump a loser again.
The CBS News poll of Michigan voters last week found Biden has a slim lead over Trump, with nearly 2/3 of Michiganders saying voting for president this year matters more than it did 4 years ago. Scott Stearns, VOA News.
Still to come in our health report, we'll have the latest on Africa Vaccination Week. Stay with us.
This week on Straight Talk Africa, what drives migration in and out of Africa, and often to treacherous routes to other countries? Some seek better jobs, others asylum, and others flee war and persecution. What will it take to curb the migration? Join Vincent McCory for an in-depth analysis on the next Straight Talk Africa.
Season 4, rocking with the best. Rocking with the best. Season 4, rocking with the best. Let's go.
In other news, the British government has published plans that reveal they are expecting to deport nearly 6,000 migrants to Rwanda this year. The UK Interior Ministry says Rwanda has, in principle, agreed to accept 5,700 migrants already in Britain. Linda Thomas-Greenfield, the U.S. ambassador to the United Nations, has issued a warning to all countries to stop support for Sudan's warring parties. The UN has voiced concern in recent days about a possible imminent paramilitary rapid support forces attack on al-Fashir in Sudan's North Darfur region. And gasoline shortages are worsening in Nigeria's major cities, with long, winding lines at fuel outlets crippling transport and businesses and highlighting the state oil firm Nigerian National Petroleum Corporation's struggle to meet supply obligations. One of the healthcare challenges in Africa is the shortage of training and education for workers. To help, a U.S. charity called Mission to Heal is training healthcare workers who serve patients in remote locations. Juma Majanga has more.
It's a beehive of activity at Ngorunit Health Center in a remote village in the dry Marsabit County in northern Kenya. Residents have gathered here, some traveling tens of kilometers to seek medical services. On this day, the U.S. medical charity Mission to Heal is providing more advanced medical equipment and training local medical workers to use it.
We take the experts that live here and we bring them in there and show them how it is that we can do things and get the principles without the plumbing. Taking care of the people in the context of their culture and their family setting is something that's going to happen here.
Mission to Heal founder Dr. Glenn Gilhod says their goal is to empower local caregivers with knowledge and skills to improve medical services in remote locations like this.
How do you tie the last knot?
Meshak Lekeda is a local nurse at the Ngorunit Health Center.
They've even taught me how to manage some new conditions here and there that I never knew before. And they've even equipped me with the equipment.
A 2019 report by the U.S. National Institute of Health found that a key problem facing the healthcare in Africa is weak training and education of workers. Kristen Alcon, a volunteer, says Mission to Heal can help.
They have the knowledge, but their resources are limited. And so I think that we can help them try to best manage things and come up with diagnoses and come up with the best possible diagnosis and treatment with their limited resources. Symptoms?
Senaheya Kalaili traveled over 30 kilometers to seek treatment.
I came here in a lot of pain, especially my abdomen. The doctors gave me 2 injections and medicine, and now I feel better. The pain has gone down.
Volunteer medical students say they are learning too.
Obviously the culture is very different and the resources are very different, so there's been a steep learning curve in terms of figuring out what we can do and really what we should do.
For me, a big thing was like using gloves for the second time. Back home we use the gloves and we toss them. It's not like normal to use it the second time. And they do with everything.
The UN Development Programme says some 408 million people in sub-Saharan Africa still don't have healthcare. Mission to Heal says it has trained 3,200 healthcare workers on the continent. Juma Majanga, VOA News, Goronet Village, Kenya.
It's time for our health report, and joining us now is Africa 54 health correspondent Lino Mudu with a look at vaccines. Hello, Lino.
Hello, Esther. The United Nations says 3 more African countries are joining a rollout of malaria vaccines targeting millions of children in Africa, which accounts for 95% of malaria deaths. Benin, Liberia, and Sierra Leone are offering the malaria vaccine as part of their childhood immunization programs. 2 vaccines, RTSS and R21, recommended by the World Health Organization, are being seen as a breakthrough for child health and malaria control. Africa Vaccination Week is held every year in the last week of April to advocate for stronger and more effective vaccine delivery systems across the continent. The event coincides with World Immunization Week, which emphasizes the collective action needed to protect people from vaccine-preventable diseases. The WHO says immunization prevents up to 5 million deaths a year from diseases like diphtheria, tetanus, and measles. UNICEF reports that at least 20 million children missed life-saving vaccines in 2022. That's 2.1 million more than in 2019. But the new simplified cholera vaccine approved by the WHO allows larger volumes of the serum to be produced faster and reach more children. As Africa Vaccination Week closes, I spoke with Tabani Maposa, Gavi's Managing Director of Country Programs Delivery, to discuss a progress made on the vaccination front and other challenges.
In the last 50 years, 6 lives have been saved every minute with vaccination. In the last 23 years, Gavi has been part of the story, and it has been vaccinating half of the world's children, and it has reached 1 billion children that have been vaccinated.
What is the significance of the approval of the new UV-Col-S vaccine, particularly in the context of the recent increase in cholera outbreaks globally?
The significance really is where we are from a time perspective, that in no time in history have we had such large and significant cholera outbreaks as we do now. And so another vaccine and an increase in supply really means we are well poised to begin our plans to move towards preventative campaigns or preventative programs. We are not there yet. Because of the demand that has been surpassing supply.
Vaccine access has been a problem for some countries, especially coming out of COVID. So what is being done?
Well, I think equity is at the heart of the Gavi mission, as you know. So that means that as we think about our countries in totality, we really try to match our supply to the demand, but we also really try to understand the epidemiology or the disease burden in these countries. And in that regard, we try to prioritize those countries that are at high risk.
Gavi is working with the Tanzanian government currently to launch a nationwide HPV vaccine campaign to prevent cervical cancer in the country, among other things. Can you provide more insight on this initiative?
the number of girls that Tanzania is projecting to protect is about 5 million, 9 to 14-year-old girls. And I can tell you that this is the number of future cancer cases, cervical cancer averted, if we are able to come anywhere close to that number. Tanzania as a country has more than 10,800 cases. And of these, in 2022 alone, if you can imagine, we lost, unfortunately, 6,800. So this vaccine excites me because it really is about protecting the mother, but it is also about protecting a family. It is about protecting a girl, but it is also about protecting her future family as well. The thing that is also important about this vaccine is that we have moved to a single dose. So meaning that we can reach more girls than we would have if we were using 2 doses as in the past.
So what is your message as Africa Vaccination Week ends this year?
In Africa, I can say that an estimated 51.2 million lives have been saved through vaccine in the past 50 years, meaning that in each year we've been saving maybe roughly on average 1 million lives. But I should argue that there is more that can be done. I think we just have a meningococcal vaccine for the meningitis belt, and this is going to protect with 5 serotypes. We used to have one that was protecting 1 serotype. It means that the health benefits are just going to multiply in a significant way. The message is both for Africa but also beyond Africa. The investment in vaccines is one that should be sustained. As we go towards replenishment, we must actually recognize that the investment in Gavi has been the best buy for money. But we must also recognize that countries have put their own money. Just in 2023, 215 million of domestic financing has come through as part of their country's contribution towards immunization. And it must be recognized as a very important contribution. Then you and I, the last time we spoke, we were speaking about malaria. Malaria is the #1 killer. And if it has killed anywhere in a huge way, it has been in Africa. And help is on the way. And Africa must stand up and take up that vaccine and use it as effectively as it can.
That was Tabani Maposa, Gavi's Managing Director of Country Programs Delivery, speaking from Johannesburg. That's our health report for today. To stay in touch, find me on X at Linor Mudu. Back to you, Esther.
Thanks, Lino. Be sure to watch Lino Mudu's health reports every Tuesday on Africa 54. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.